Listen to the patient, please.
Which symptoms have brought you to us today?
I came because of a very strong nausea and strong dizziness.
Did it begin suddenly or develop slowly?
It began suddenly.
And how many days ago was that?
That was on Wednesday at 7 p.m., 2 days ago.
When the dizziness occurred, did you have a tendency to fall to one side or unsteadiness of gait?
I felt very, very nauseous, and an unsteadiness came, and it turned me slightly to the left, or more like it shoved me.
So this is a typical history, acute onset of severe spinning vertigo. Most patients have to rest for several days in bed. They're not able to walk. And here you see the clinical findings. If the patient is able to fixate, there's nothing you can see. But if you prevent visual fixation, you see these eye movements. They're called nystagmus. This is a Greek term. And you see the eyes, the quick phase to the right and the slow phase to the left. And that's a typical clinical finding of acute unilateral vestibulopathy. The diagnosis can be easily made by a simple test. Can you come to the podium? Take off your glasses. Okay. So you can put on these glasses with all modesty. They are called Michael's glasses. And then you can prevent visual fixation suppression of such a nystagmus. So for the doctors, it's easy. And there is another test which is called head impulse test. Can you fixate my nose? Hold your head very tight. It's going to be a rough test. I have to warn you. And then you make a very quick turn in one direction and in the other direction. And that's the way to diagnose acute unilateral vestibulopathy. Thank you very much for your cooperation. So it takes about 5 minutes till the diagnosis is made. And here you can see a typical finding. When the head is turned to the left, the eyes move with the patient's head to the left, and then the patient has to make a refixation saccade. This indicates a deficit of the vestibular system on the left side. And what is also very prominent is postural sway. You see, with the eyes closed, this subject is not able to stand. And this is something we have to treat. Another typical symptom patients have with an acute unilateral vestibulopathy is blurred vision. It's so-called oscillopsia. And that's easy for you to simulate. Can you cover one eye, please, everybody? And now press with the tip of the index finger on the lower eyelid of the other eye, and thereby on the eye bulb, with a frequency of 2 to 3 hertz. What do you see? What's happening? The image is jumping. Do you like that? No. If you do that for a longer time, you will also develop nausea and even vomiting. And here you see a video which was taken with a particular camera which allows you to see the world through the patient's eyes. It's called the IC cam. It's not an iPad or an iPod, but it's the IC cam. And that's the way patients with this disease perceive their visual environment. And all these symptoms have to be treated. Here again, the summary. So patients have this typical nystagmus, a pathological head impulse test, and a so-called nystagmus.